Okay, we'll get started. Today is Tuesday, June 18th, 3 o'clock, or 2024 at 3 p.m. So this is the Burleigh County Human Service Zone Board meeting. I'll call to order this meeting, and then we'll start by doing roll call of the members.
Galen Becker,
Here.
Senator Dever,
Here.
Tracy Famous,
Here.
Jim Holm,
Here.
Leslie Piercy,
Here.
Trevor Van Epp,
Here.
Chelsea Flory.
Here.
All right, and Commissioner Bakken is absent.
Next on the agenda, we'll do the approval of the meeting minutes from your last meeting on March 19th, 2024. So if everybody's had a chance to review those, if anybody has any feedback, comments on those, or if anybody wants to make a motion to approve.
Motion to approve.
I would second that.
Okay, we have a motion and a second, so I'll just say all in favor, say aye.
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 Any opposed? Motion passed. Next thing on the agenda is the review of director's annual evaluation. So this was completed this last month here. I thank Tracy and Commissioner Bakken for kind of speaking on behalf of the board. So last year when we did this evaluation, the commissioner at that time kind of went into it in depth during the our meeting here, but you all have it, so you've all had a chance to look it over as you're looking it over. I'll just kind of go over some areas that we touch on the eval. So overall, we just talked about goals that I would set for the next period of time. So I guess going forward for the next year, a goal of mine is to kind of do a deeper dive into the economic assistance programs that we use, more so into their funding sources and their federal guidelines. I just would like to learn more about how understanding those programs, and then that would help me advocate for the constituents that we serve, as well as ideas around like waivered programs, how to make application processes more efficient for those we serve. So that is an overall goal for me for the next year. This evaluation also goes into training that I would have completed over the last year, and then I just have to give like an oversight of different things such as supervision, fiscal accountability, program oversight, and agency responsibilities. So I definitely won't read you all of that. But you all received I tried to keep it organized and touch on every one of those pieces. So during the evaluation process, then after I provide my content, it goes to HHS for their feedback. So that's like one of the last pages you'll see HHS comments, and so they provide a fiscal perspective, an HR perspective, and then from zone operations. And then they provide me with my overall scoring. And then from there, it floats to the zone board to give feedback. And again, Tracy as my vice chair, and then Commissioner Bakken were kind of the people who spearheaded on behalf of the zone board. So I don't know if anybody has any additional comments or feedback regarding what you've been able to review of this, or otherwise what we'd be looking for is just a motion to approve this evaluation.
The only other thing I would add is, from our standpoint, I just want to say thanks for a great job, and the communication that we have between our agency and obviously working with you and all your staff. It's improved and it's appreciated.
Thank you.
Just want to say thanks.
Thank you. Appreciate it.
And Chelsea, I would agree with that completely, and just appreciate how you bring clarity to these meetings and you share out your information and your data from your different departments in a very organized way that's easy for all of us to follow and understand, and just kind of see the progression from one meeting to the next. Also, just like your strong advocacy for your staff, that's just ongoing. Like you're always advocating for things that'll help support them, and your willingness to jump in and provide leadership for them, and really help supporting them and getting them what they need to be able to do all this work, which at times it's challenging work and it's hard work. But I think like what we've seen over time is that your support has helped to build that resiliency in your staff, and it shows. Mm-hmm. And in regards to your work with community and agencies, as you referenced, I feel like you've gone above and beyond in supporting community stakeholders in aligning and collaborating together and finding out ways that you can work best together as, to support the kids of our community. So I would say thank you as well.
Thank you. I appreciate that.
Do a motion to approve?
Thank you. Do you have a second?
Second.
Second, okay. We have a motion and a second to approve the eval, so I will just say, all in favor, say aye.
Aye.
Any opposed? None, then motion carries. So, thank you guys. I appreciate, all your support over the last year, and I'm excited to just do it again. So we'll see where this year takes us, but, I would also add that at the last meeting, when I wasn't present, I was able to have my department heads give presentations on their, perspective of the units that they oversee as far as economic assistance and child welfare. I don't know if you guys found that beneficial, helpful. I think it was nice, I wasn't here to be able to have that, but I thought going forward it might be nice to have them continue to do that. They just didn't have time to prep for this one. But if I worked on them with that going forward, for me, it would be nice because then I can provide more of a piece of engagement with them. Otherwise, I just feel like it's me rambling off these notes to you guys. So it's kind of nice for me to have another person to ask questions off of for you guys. So if you found that to be beneficial, their presentation.
Yeah,
Okay.
I agree.
Okay, perfect. Then that's what we'll do. And again, I go to them, especially for economic assistance. There's a lot of those details that it'd be great to have Grace insight for her team because she gets into the details way more than I do. So, okay, so then we'll plan that for the September meeting going forward. That's kind of how we'll do it. I'll have them do presentations on their units. But for today, you get me again. So I'll start and go over economic assistance. I just have to. Okay, so it's been a really busy quarter since you guys were last here in March. March 11th, we kicked off what the department would refer to as March Madness. So this was efforts regarding SNAP applications. They were backlogged, and we have a new commissioner for state of North Dakota for Commissioner Salter came on board, and he really recognized this backlog and worked with HHS and zones to address how we were going to work on getting everybody caught up. So this backlog at that time went all the way back to October 2023 at least. So we had applications sitting all the way back to October that hadn't been processed or worked. So again, that's clients not getting benefits that they needed to be getting. So in March, we kicked this off, and we worked to approve comp time or overtime depending on the zone, and then employees were able to work additional hours to address the backlog. We also did an interactive spreadsheet that we review weekly. So we now have weekly backlog meetings we attend where it is live in action. We're looking at spreadsheets and we're pretty much calling out the cases and we're assigning people. We're really identifying which ones are expedited applications. Those are people who are needing those benefits immediately, and then which ones are ones we're processing, and we have more time for those. So I think that the interactive spreadsheets really helped us keep the momentum by doing those weekly check-ins. I don't know if those will continue to happen now that we're caught up, but I find them to be very helpful to just kind of keep people understanding the urgency of this. I think oftentimes in child welfare, it's right in front of you. You see what's happening and you see the people, and so sometimes it's harder in economic assistance because you don't have that. So I think this was one tool to do that. But as of today, all SNAP reviews are caught up to May 2024, and we're processing new apps timely with May being the oldest. So we're basically in compliance with timeliness regulations. So in late 2023, early 2024, our application processing timelines for our expedited was about 40% timeliness, which is bad. And we are now at this point at 80%. And then for our non-expedited applications, we were at 70%, and we're now over 90%. So these efforts of March Madness were fantastic. So kudos to all the team members, not just Burleigh County. Again, these are statewide efforts. These aren't just our local constituents. These are people all over the state of North Dakota needing their benefits. And so kudos to all economic assistance team members from any zone who participated in that. Other update would have been Back in March, we were talking about combination of groups 2 and 3. So I think I've kind of talked in previous meetings, the structure of economic assistance. There's 4 groups. So group 1 is your Medicaid only. Those team members process those applications. And then 2 and 3, and then we had our group 4, which was our TANF group. So 2 and 3 really combined their programming, and we moved childcare to group 4. So it was kind of like an operational change to help streamline and move things along. So I'm sure Gray got way more into better detail than I just did right there. But that merge of groups 2 and 3 was completed. So now technically we have the 3 working groups. We shifted the work of childcare assistance to group 4. That it has been a big shift in workload. So we've definitely had to work as zones to shift positions. We call them FTEs, like the full-time employees or full-time equivalents, to that group in order to meet their new workload. So that's been a challenge and a lot of communication to decide what team members would shift to that group. But I think at this point in time, they're feeling good where they're at, and then we'll continue to monitor for their workload for if they need more positions. But other area I want to talk about was the call center. So I know in previous meetings, that's since redesign kicked off, that's just been a point of tension with wait times, calls getting dropped, the volume coming in the call center. My point of view would be, because we weren't getting cases worked through these groups and people were waiting, we were getting more calls into the call center, because then people are curious where their benefits are. So I've always really put stress on, we need to address the work queues and getting the work done, and then the call center will improve. So at this time, reports that we get out of the call center is that time has improved, and we've now staffed the call center more appropriately. They just added 6 new additional employees to that. So right now their hold time is under 2 minutes for those calls. So I think this is a big one for any of my stakeholders. If you have constituents who are frustrated with the call center, just encourage them to continue utilizing it and calling. It is a work in progress, and I do feel like we're making improvements. And again, I think dealing with the backlog in the work queues has helped with that volume. But there's also an apply for help email. That's a great way for constituents and clients to communicate, and those are also up to date. They're processed daily. We were in a backlog in that email too. So then if a client was emailing in there and didn't hear, then sometimes they'd call the call center after a few days, and it was just bogging it all down. But I think at this point in time, we feel like we've kind of right-sized the staffing. Another thing I wanted to make sure we touched on was we have this self-service portal, so we'll call that the SSP often in our lingo, but it's a portal that constituents can go into to upload documents and work within there. And they just did some testing on that portal. We were able to have some clients come in and participate in that, and we got some good feedback. I don't know if I brought the exact feedback from that, but we got feedback on like its ability to be user-friendly, actually loading documents and then they stay, or is there an error within the system? So we did this testing, and Burleigh County participated by having clients in. We had somebody on site for a full day. You would work with a member of the, I'm gonna say the team that designed the portal. And so from that, there was good feedback, and they are working to correct some of those errors. So anybody have questions so far on any of that stuff? Trevor, I know that you're always really invested in my SSP and my economic assistance. I don't know if you had any questions or feedback.
Just same thing you said, the processing time is very slow. It's getting better, but it's hard when you have new staff and they don't know what's going on. It's just very hard for a client to keep repeating themselves.
Yeah, and I think to Trevor's point, not only is there turnover with staff, but then some policies that are applied had changed with that public health emergency and the unwinding. So I think last update I had is we are fully out of the unwinding. It's completed at this point. There was impact. Definitely you would hear that from constituents and clients, that people who might have been eligible before, they were denied coverage, because now after that PHE is lifted, we actually start looking at income again. So if that makes sense, like you could have been on Medicaid and then during the public health emergency, it was kind of froze and you just were automatically given those benefits. But now that that's been lifted, we start looking at income again. And so some people are dropping off coverage. So I've definitely heard from many people about that.
And when you have the turnover in staff also, like there's special accounts that are exempt, and it's just training those people on what to do can be the challenge too.
No, that's a good point, Trevor. And we've talked, my management team, I'll say, is very vocal about their thoughts and feelings on that. And they've definitely advocated to specialize work groups that focus on those populations in order to ensure you have that expertise on those policies. Because if you don't work those type of cases every day, and then to remember to apply certain policies based on those variables. So that is a very good point, Trevor, and something that Burleigh County continues to advocate for that.
Yeah, because I can see it when different workers do the right thing and then others don't. It's very difficult. It's very hard to understand.
With that point then too, we did do focus with the department on the notices that clients receive. So when they are applying for benefits, if we're like, you still need this additional information, or really what action steps we're asking them to do, they weren't user-friendly. I'll tell you from looking at them, if you didn't have a lot of experience in looking at documents like that, you kind of get lost in all the words that are on the page. So we really are working to make them user-friendly, easier to understand, more specifically laid out with what action steps we're asking the client to do, hoping that this will prevent delay in benefits or somebody maybe not getting documents and then cases get suspended or ended. And then this would promote timely processing. So, Trevor, I'm sure you would agree that those notices aren't always the best to understand. Last thing I'd go over for economic assistance is EBT cards. This is a huge push for me, but many zone directors, that EBT card issuance be back in-house. So right now, they currently were, and then when redesign happened, they went to this third-party vendor. So I don't have any updates. I feel like I'll talk about this at every meeting just to make sure it's on my radar and hold me accountable, and also the department. But it is still the intent of zone directors that this is what we would like. The department agrees of Health and Human Services that we should do this. It's just a process now, and they want to look at hybrid options. So if somebody would like to walk in and get one, can we do that as well as people who would just like to go, call into a number or go online and get one ordered and sent to them? So now they're trying to explore a hybrid version. So that is still in the works. But to me, it's very critical that we're being timely when I talk about March Madness and getting the benefits to the clients technically, but then they don't have the card to go start using those benefits, and it can take a week or two. So clients are still being impacted by a delay. And then with EBT, I just thought I'd share that state of North Dakota did offer a summer EBT program. So this was for school-age children who were eligible for free and reduced price meals during the summer when they wouldn't have access to those meals. So this was a benefit of $120 per eligible school-age child. Each eligible child received a summer EBT card that was loaded with what they called Sunbucks. So this was their summer EBT program. So I just thought this was a great initiative that the state of North Dakota Department of Health and Human Services, this was a partnership between them, public instruction, the USDA, Food and Nutrition Services, and I just thought it was a great initiative that should be recognized. That's pretty much all I got for economic assistance. Does anybody have any questions? Okay, next we'll move into the child welfare portion. You did get an updated org chart, so that's in your guys' packet too. I just thought that would help because we were able to add some additional FTEs. I think we were approved for them the last time that you guys met, but they're officially on and onboarded now. So with CPS, we have a team of 2 supervisors and 11 child protection workers in that unit. So that's the team back in March we requested and were given that 11th position. We also had some turnover in that team. So As of yesterday, the 17th, we are fully staffed, but 3 of those team members are within 6 months. So I just always like to point that out because you can only do so much when you're a brand new employee. So we're just really working on training and onboarding for those team members. And then that puts a lot of extra work on the other members to do some of that training and then also carry the bulk of the work that's coming in. We continue to work with the child protection team on overdue cases. That's probably been our focus for the last 6 months. We've done some different creative things to work with team members individually, whether that was stopping the flow of cases that are coming in so they could focus on the ones that were older, extra support sorting through documents. Sometimes your heavier cases come with more medical records, court reports, law enforcement records. So a lot of times it's just help sorting through that. We've done additional support where myself, members of management are helping type some of these reports up to just keep things moving. So I will say that last update we got, or I guess feedback from the department on Burleigh County is, we're doing better. We're closing a lot of those older cases, so we're definitely moving forward, but we just still have a lot of work to do. It's also a continued balance between the importance of timely assessments and timely face-to-face with victims. So as new reports are coming in, our workers are having to balance getting out on those cases and meeting those guidelines for, depending on how many days they need to see the victim, and staying within that requirement. So again, they're doing a fantastic job with the work that's coming in and the turnover on their team, but that's kind of where we're going to continue to move for at least the next 3 months. And then centralized intake operates out of, I would call it out of the CPS team, so that's a statewide unit. They were also approved statewide to add an additional worker. I don't know. We have, one of the CPS intake workers is employed by Burleigh County, but they're employed throughout the state at different zones. I don't know who's gonna end up picking up this position yet. I think it'll probably depend on applicants that they get. And I don't have a exact number on how many we have statewide now. I feel like the last presentation I did for Bismarck Public Schools was 13, with 2 of them being supervisors. So this might make them a team of 14 now, but don't quote me on that part because it's been a while. But our in-home team, we added an additional employee to FTE to that pool as well. So they have a total of 1 supervisor now and 6 workers in that unit. That member onboarded on in June here. So again, just still within that 6-month period of training and onboarding them. I think often this is probably the data when you guys are looking at the data that Tian puts together for the board when that shows in-home cases. In-home to me is the one that ebbs and flows a lot. It always depends on what we're seeing come through CPS. Some of those cases then they may be open and in-home, and then they could have an incident that occurs in the family and it results in foster care placement. So that one does flow quite a bit when you look at the spreadsheet for that. But so there was a period of time back in probably February, March when we advocated for this position when they were a lot higher, and then now you can see they're by May here they're starting to dip downward. So then what we do is we have in-home help with some of the foster care cases as they can. So that would probably bring me to my next piece is that I'll talk about foster care a little bit. They filled an additional open position here in June, so they're fully staffed on that team now too. March 25th, so about a week after you guys met till about end of April, Burleigh County ended up taking custody of I think 24 youth, and then we've continued to take on more kids since then. I just don't have the exact number. So that's a lot of children in a 30-day period of time. Most of those were related to in-home cases where we're doing prevention work, but ultimately the safety planning for, due to failed safety providers who are going to provide that safety or whatnot, we end up what we call long forming the cases, and then we're requesting the court for custody through that. So the point I'm trying to make is these are active efforts that the zone is making to be least restrictive and do some of these prevention efforts to keep families out of foster care. But ultimately, we did have, and not all of them were from that, but a big bulk of them were from prevention efforts. So that's a large influx of cases, and So we're gonna continue to look at the caseload for foster care, and I guess continue to see now that they're fully staffed if we need to request additional team members for that one as well. But again, it's nice because then we start to lean on our in-home team instead of just asking for another position. If their caseload's down, we try to lean on the other team to help. So with that, then Health and Human Services is kicking off their case management redesign. So this is an 18-month commitment to really look at foster care and in-home and redesign the processes of it. Right now, zones are really siloed, where if you do in-home, you do in-home. If you do foster care, you do foster care. We're starting to work on with our team on getting them educated on both. And then that way, if a case is in-home and it results in a custody, they just keep it and work the foster care piece of it instead of transferring it. Really, it's for best practice for the family because you stay with the worker that you have that relationship with. The hard part about that is they have two different sets of policy. So now I'm asking workers to not only understand their in-home policy, but their foster care policy, and depending on their caseload, they do different work in the court. So it'll be, I'm glad we have the 18-month transition to try to work on that with our team members. But any questions on that part so far?
That balance of knowing both could be frustrating to foster care providers as well.
Yeah. Yeah, I'm hoping that through the redesign, those are things they're considering, and they're really gonna like marry the two programs. I mean, there are certain things that have to be done different because of foster care and funding, but I'm really hoping they streamline them both, because it's hard for the workers to try to remember based on their caseload which policy they're applying. You know, where CPS, you just have your CPS policy.
And if you're not getting that differentiation, you know, that I have a worker who doesn't normally work
Yep.
these, right? Then
Yep.
you're like, why don't you know what you're doing?
Yep, no, good point, yeah. Yeah, good point. So for the providers watching, yeah, giving grace to the workers, because yeah, we have a lot of in-home workers who, now that they're picking up foster care cases, they don't know some of those things that your experienced foster care workers just know. I think court and engagement with foster parents are two of the biggest pieces of it.
Yeah.
Yeah, good point. Again, which is why I'm glad we have 18 months. We're not being requested to start this. This is just what I think is best for Burleigh County to start moving towards it. We know that this is where it's going, so let's just slowly start to dip our toes in and get used to what is happening. But again, it's part of a whole bigger redesign, and we'll kind of see where it goes from there. But okay, additional things that we're doing in child welfare, I would say over the last 3 months, we've done a lot of work, what I'll call ICWA work. So we've been partnering with the Native American Training Institute, working with them on recognizing biases within our team members, trends within the community that have a greater impact to this population. How do we greater serve this population? How do we identify services that are culturally aligned? It's not, you know, it's definitely our population that has the greatest percentage of youth in foster care. So we're trying to just dig into the why and how do we do some prevention work around that. This is still definitely in the initial stages with this group, with NADI partnering with Burleigh County. So we're still identifying their mission, vision, value statement. I'm hopeful that at the September meeting, we can talk more in depth, and maybe they'd be willing to present to the team and kind of talk about it. Again, this is accountability for Burleigh County. This is not something we have to do or an initiative we have to prioritize. It was something they brought to us, and I feel like it's important for those that we serve. So I think having them come and present will just keep us accountable.
Do you think that'd be a good topic for Foster Parent Association meeting too, once you guys kind of get rolling?
Absolutely, yeah.
Uh-huh.
Yeah. Yeah, we just developed the name of like kind of the work group and the mission, vision, values. I just don't know that that's all finalized to share with the group, but I think by September, and then, yeah, we could
Yeah,
present.
it'd be interesting to talk about those biases as
Mhm.
well.
Yeah, NADI does a lot of great work with what they call balancing biases. So learning where you're at on the scale of family preservation versus safety. So we all land somewhere on what we think is more important. And so it's about understanding where your biases are and being aware of them as you're practicing, so. We're also working with them on ideas on how to engage team members to be what I would call ICWA champions. So different creative things we're gonna work on internally as an agency. And then coming up in July is the ICWA conference, and we've had team members be asked to sit on a panel and provide additional context regarding success stories that they've had with families for reunification and being culturally aligned. So I think that that's fantastic that they've been recognized for that and they're being asked to present, so. Additional thing that we did in child welfare is motivational interviewing. So again, this is something that Burleigh County identified as being important for our team members to be trained in motivational interviewing. So it's, I don't know how familiar everybody is, but it's really engaging with a client who might be resistant to change. Very complex, right? I thought I was going to attend a 2-day training and walk out and be able to do it. And I left more confused than I went in. It's very complex depending on where a person is at in their stage of change and the conversations and feedback you want to give the client, and then they can move throughout the stages of change fluidly. So reality check, it's going to take a lot more than 2 days. But pretty much all of our team members went through the initial 2-day training. We only had a handful miss due to scheduling conflicts, but we're going to work with Case Western is the company that does the training. They partner with the UND Training Center, so that's a contract through Child and Family Services to do a lot of our training. So we're working with them on next steps now for ongoing training. So what this is we did the 2-day initial, and now we're going to be working with coaching sessions, identifying themes that we see with clients, like hard to engage clients, and then we're going to focus in on that. We're going to be working with them to do identify champions within our team. We do have some people who have been trained on this through other previous jobs, and they identify themselves as champions, so we're going to kind of be cultivating that too. So this was something that was huge for me to get our staff trained in to help have behavior changes really within our foster care team when we're stuck on cases that they're not moving anywhere for years at a time. Any feedback on that, if anybody had experience with motivational interviewing or anything like that? Okay. Last thing I wanted to talk about was targeted case management, which I think I wanted to double check my agenda, but next we'll do the financial report. So I'll talk about targeted case management, and then that'll flow right into our financial report. So I think at our last meeting, Jeremy Smith, the department head for child welfare, was able to talk about what this is. So often work that we're doing through case management could be billable, but we haven't been doing that in Burleigh County, and it took some time. Like, you have to get registered to do it, and then it's getting staff trained on how to do it. So a lot of work that we're already doing could be billable for revenue. We just haven't been capitalizing on it. So this was out of legislative session, really a focus that all zones go back and start looking at targeted case management billing. And some zones were doing it, but most were not. So Burleigh County wasn't unique to not be taking advantage of that. So this was definitely a missed opportunity for revenue. Right now, where we're at in the process is we started with some basic training for team members as far as what goes into their narrative of their notes that then we submit for the billing. So we're working on that with them, but we're really probably held up more on the county level with information that we need to get us established as a billable agency. So more to come, but that's definitely a huge initiative. I do not want to go back into legislative session as the only zone who's not doing targeted case management billing. So we'll definitely be pushing on the local level to get this rolling so we can start getting the revenue. Any questions on that? All right, we'll just get into next item on the agenda, which is the financial report. Tan also included that in your packet. So this one, you'll see the 2024 annual initial budget, and then there's the column, which is our revised. So that's halfway through, we do a recalc So when we sit and look at our areas, our line items, and where do we anticipate we needed more, needed less, that kind of stuff. So that last column, the percentage changes, I mean, there's things in there that obviously look much like our larger increases, which was the insurance expenses, and then zone vehicle maintenance, both of those went up quite a bit, but that's because we added the addition of a second vehicle to our zone team. Otherwise, most of the changes were not huge hits that we took. The other one would be the client-related services for these are just some of the ones that I called out were legal services, transportation, those kind of things. So I don't know, Tayan, you have any feedback, I guess, on this?
No, I guess in the client-related services, part of that is because they overall kind of changed some of the different line items that we consider those as. We kind of went from one generic item and broke it out into transportation, daycare, and all these different specifics. So we kind of our initial budget was based on best estimates from kind of previous years, but in those areas that hadn't really been broke out specifically. So at this recalculation time, we were able to kind of fine tune those into what we're actually seeing this year. So that's kind of why some of the change, really not a big overall dollar amount change, bottom line wise. It just, some went into transportation, came out of childcare, that sort of thing. We just kind of juggled some of those around.
And then at the bottom, you'll see the anticipated agency revenue. Again, when we're planning our 2025 budget, we're definitely setting some bigger goals for ourselves to have a lot more in that revenue piece with that goal if we're doing the targeted case management. So as we go forward in future meetings and we look at that budget, I'm hoping that we'll be more on track to have that revenue. Anything else any questions, I guess, or follow up on the financial report? Well, okay. And next on the agenda is public comment, and there's nobody here to comment, so we'll move on to the next one, other business. I don't have any other business. I kind of went through my stuff, so I just opened this up to the board then if they had any pressing topics or comments or thoughts on future meetings of what they'd like to hear more about. We kind of already talked about the structure of the future meetings, having my department heads present at those ones, but or my program managers present at those ones, but I don't know if you guys have any other interest. Like I said, I can bring our ICWA partners in and see if they'd like to present on our collaboration, but if there's anything else you think that you'd want to know. Okay. Well, then we'll adjourn the meeting. Thank you.